We're standing here in front of Advocate Hospital to announce a settlement of a court case brought by Vanessa Cristiani for providing charity care and reduced price care to citizens in this Chicago area and patients of Advocate. This is a case that has been long in the making. It was filed in November 19, 2003. We've now reached a settlement that all parties, including Advocate, can take pride in. Advocate has agreed to significant changes in the implementation of its charity care policy. It will keep in effect a charity care policy that provides free care for people who make families that make less 200% or less than the federal income poverty guidelines, and reduced price care for families that make 400 to 200% of these federal income poverty guidelines. This is a charity care policy that was revised during the case. Advocate has always had a charity care policy, like other charitable hospitals around town. The significance of this case is that it simplifies the application procedure. It requires Advocate to give out an application form to every single uninsured or underinsured patient who comes here looking for services. It has an ombudsman, a person appointed by, agreed to by all the parties, who will ensure that the applications don't get lost in the process, that obstacles are removed, that people don't get dropped out, that no one is sued while the application is pending. It's a significant change, and we salute Advocate for its cooperation in ending this suit. After Advocate tried very hard to have the suit thrown out, they were very cooperative with the plaintiffs in implementing this new system. What we're trying to do today, in this time of freezing weather and economic meltdown, is get out the word to people not to be afraid to come to the ER when they need medical services and are urgently in need of medical help. A trip to the ER in this country should not have to be an invitation of bankruptcy. We do feel that as important as this settlement was, and we again salute Advocate for agreeing to bring this litigation to an end and implement these changes, as important as this is, and as important as it is to get out the word to people that they can come to the ER when they need help, it is also important to stress our view, plaintiff's view, and I believe the view of many people in the medical community, that these sorts of lawsuits and settlement are not enough. We need change in Congress. We need a single-payer health system. We need this even more as we lose jobs throughout this country, as more and more people are facing a no man's land where a layoff can also be a death sentence if they are sick or in health or their loved ones are very ill. So while we're proud of this settlement, we're proud of what Advocate has done in agreeing to this settlement. We want to emphasize to people not to be afraid to come to hospitals like Advocate, and not just Advocate, other charitable hospitals. Advocate is no different from any others in its policies and practices. Other hospitals ought to step up to the plate like Advocate is doing and provide charity care to people without fear, without scaring them, without intimidating them with lawsuits, without piling on endless application forms. We urge Northwestern and other hospitals to adopt the same procedures that Advocate has. But we also want to emphasize our view as plaintiffs, as citizens of this community, that this system of going around and suing hospital by hospital to provide charity care is not an answer to our medical problems in this country. We need a government commitment to extend the Medicare we give to senior citizens to everyone. Young mothers, children, people who aren't qualified for Medicare but have been laid off at 60, at 55 and have nowhere to go until they get to Medicare to take care of their illnesses. That's why we hope that this settlement will not only provide immediate assistance to Chicagoans during this economic crisis we're now in, but also inspire all of us to go further and get a system that ensures that everyone, without having to make an application for charity care, has a right to health care. Thank you.